Hello, everyone. Today we are going to discuss contraception in minors, which means that we will be discussing the rules and regulations regarding offering contraceptive advice to people who are below 18 years of age. This is the third video in the Obs and Gynae series, and in the previous two videos we discussed regular contraception and emergency contraception. Okay, so we discussed the entire history taking there. And if you are not familiar with how to take history from patients who present with the request of emergency contraception or regular contraception, then I recommend that you first watch those two videos. Okay, so while dealing with people who are less than 18 years of age, we have further three categories. Okay, so those who are below 13 years of age, those who are above 16, and the third one is between 13 and 16 years old. Okay, and the laws and the rules are different for each of them. So those who are below 13 years of age, there is no way that you can offer any contraceptive advice to any child who is less than 13 years of age. Okay, this is illegal. So what you have to do is to inform the safeguarding team. Okay, so every GP surgery or every NHS hospital have a safeguarding team, and you need to inform them, and then the safeguarding team will do the rest. They will contact the parents, and if police needs to be involved, then that is their job, and they will do all of it. However, if you have a 13 years old presenting to you with request for contraception, you are just not going to, tell them in the beginning that no, I'm not going to offer you any contraceptive advice because you have 8 minutes of station, and you cannot simply do that. This will mean that your station will end in like 1 minute or 1.5 minutes. So what you are going to do is you need to take the history here, a full detailed history. So just take the history as regular, tell them that, okay, we will see how we can help you with that. Can I just ask you a couple of questions? And then take the history in a similar manner, but, ask the safeguarding questions here. Ask about the partner in detail. Who is the partner? How did she met the partner? What is his age? What is his, his relation to her? Does she know her in any way? Is he in any position of authority, like maybe a teacher, a coach, or anyone? And so these are the questions that you need to ask. You also need to ask whether there is any force or coercion involved, as you told him not to mention it to anyone, etc. Does her parents know? So all these questions you need to ask, and then when you come to the management part, then you need to tell her in a very sensitive manner that you know this is you are a very young child, and it's legally not allowed for your partner to be in relation with you. And what we are going to do is we're going to inform some of our colleagues, and they're going to come have a chat with you. By that you mean the safeguarding team. Okay, so they will come and have a chat with you, um, and we'll see what can we do to protect you. All right, so that is for people below 13 years of age. Those above 16 years of age, it's simple and easy. Those above 16 years of age, we treat them as adult patients. So the rules there are similar as in every other adult. Okay. And then we have the gray area, those between 13 to 16 years of age. Now, this is a gray area, and there are some things that you need to keep in mind. So while taking history from these patients, you need to ask about the age of the partner, the nature of the relationship. How is the relationship? Is it, a normal relationship? Is it an abusive relationship? Is there any force involved? And then the genetic competence of a child. So you need to ask these three things. The reason for these is, the age of the partner. Now, this is really important. If the partner is roughly of the same age, 1 year or 2 year older or younger, then it is fine. But if there is a huge age gap, like the child is 15 years of age and the partner is 30, or the child is 15 and the partner is 25, okay, then this is not okay, and you are going to inform the safeguarding team. But if the child is 14 and the partner is 15, then it's all right. But in some cases, even if the child is 15 and the partner is 19, then still the age gap is because the partner is legally a major, and your patient is minor. So this is again kind of alarming. So this area is a little bit difficult, and you need to watch out for the age of the partner. Then the nature of relationship, you need to ask all the safeguarding screening question in the history. So can you please tell me a little bit about your partner? How did you meet? How is the relationship? Do you feel happy and supported in the relationship? Is there any kind of force involved? So these questions you need to ask. And then the GILIC competence of the child. So I will explain a little bit about GILIC competence because this is really important. So you might have heard about GILIC competence and Fraser guidance, and these two are often used interchangeably, but there is a little bit of a difference. Now, GILIC competence, it's kind of a general term. So GILIC competence means that it refers to the ability of the child to give consent to a treatment without parents' involvement. So GILIC competence kind of assess whether the child is intelligent enough to understand the procedure and give consent for the procedure without the involvement of the parent, whereas Fraser guidelines is specifically for contraception. So Fraser guidelines it tell us whether we need to apply these Fraser guidelines, and we should be satisfied with each and every part of the Fraser guidance before we can determine that the child is intelligent enough to receive contraceptive advice without parents' involvement. Okay. So we are going to see what the Fraser guidelines states. Okay. So there are basically 4 points here. So the Fraser guidance states that you can provide contraceptive advice or treatment to someone under 16 years of age without parental consent if you are satisfied that the young person understands the advice. Okay, so understanding the advice is the first part. The young person understands the moral, social, and emotional implication. Okay, so understanding the advice and understanding the implications. The third one, cannot be persuaded to tell parents or allow the doctor to tell parents that they are receiving contraceptive advice. So this is the third part, that they cannot be persuaded to tell parents by themselves, and they are not letting you inform their parents that they are receiving contraceptive advice. And the young person is having or likely to have unprotected intercourse regardless of whether they are provided with contraceptive advice or not. So this is the fourth point. All right. So you need to tick all these 4 boxes while you are taking history. Okay. So how you are going to do that? You're going to ask questions. So for the first part, you will ask the question like, you'll ask the child, so do you understand why people take contraceptives? Okay. So do you understand why people take contraceptives? And they say that, yeah, it is to avoid pregnancy. So if they say this, then they understand what they are asking for. So they're understanding your advice. All right. Then the second part is understanding the implication. So you will ask, so do you know if you don't take contraceptives, what will happen? And they'll say, yes, I can end up getting pregnant. And this is the second part, and they do understand the emotional implication. Then the third part is telling the parents. So you will encourage them while you are taking history that have you discussed this with your parents? And if they say no, then you're kind of going to encourage them, tell them that it will be best for you if you discuss with your parents, and and if they say that no, I'm not going to tell my parents, then you can further say that if you're scared, then we can also we can help you in telling your parents, and we can help you in talking to them. But if they are adamant that no, they don't want their parents to know, then you cannot you will you cannot force them. So moving on to the fourth point, the person is likely already having or going to have unprotected intercourse regardless of whether they are provided contraceptive advice or not. So for this, you'll ask, what if we don't advise you, if you don't write a prescription of contraceptives for you, are you still going to proceed with your relationship? And if they say yes, then you have ticked all the 4 boxes in the history, and it means that they are Fraser competent, and you can write a prescription for this person without involving their parents. So this was about the legality of writing, advising contraceptives to people who are under 18. And the rest of the management, like the management part is the same. If they are, if they are above 16, then you are going to treat them as adult, and the management will be the same. If they are between 13 to 16 years, they are Fraser competent. The partner is roughly of the same age, and the relationship is not abusive, then you are going to prescribe contraceptives. based on patient preference and depending upon the history. If she doesn't have any contraindication for a specific type of contraception, then you are going to provide it for them. And below 13 years, it is absolutely out of question. So the management is going to be same. There is no change in contraceptives for people under the age of 18, with the exception of Depo-Provera. They don't advise giving Depo-Provera to, the injectable contraceptive Depo-Provera. They don't advise to give it to people below 18 years of age because it has significant association with osteoporosis, and they don't want people to start them early on in their life because it can increase the incidence of osteoporosis later on. So that was all about contraception in minors. I hope it was helpful, and I will see you soon with the next video.